Thanks very much, Joe. And thank you to the Dean, the Krembil family for your support for this most incredible Center for Health Management and Leadership. It's a great thing that's happening here at Schulich with your support. I'm pleased and excited to moderate this esteemed panel this evening. As Joe has alluded to, COVID-19 has had a profound effect on our sector. It's destabilized countries around the world. It's hurt our economies, and there will be long-lasting effects on our healthcare system. Most notably, we're seeing instigation of long growing surgical backlogs, an overall talent strain in health across all disciplines, including our caregivers, and really hurting our access to care, quality care at home, in our community, and health facilities. The pandemic has illuminated long-standing structural challenges that leaders on our panel and our audience know very well. But I think it's also equally illuminated new ways of working in healthcare. And there's been some innovation through the pandemic. So I'm pleased to bring together our panel to do a deeper dive on the important theme of the future of workplace culture in the healthcare sector. Our panel will consist of leaders in healthcare and technology who will speak to unforeseen shifts in labor dynamics, the enduring implications of workforce attrition and burnout, and provide an examination of the leadership skills and traits needed to lead in the COVID and post-COVID era. Very briefly, for the format of the panel, each of our speakers are going to have 15 minutes to share their views on their respective topic, followed by 1 or 2 questions and a 5-minute Q&A. And we'll end with a group Q&A and ask Joe to help close this session. Logistics, just a reminder for our audience to keep yourselves on mute. We're lucky to have Anna Rude monitoring our Zoom chat. And we really encourage each of you, as you're hearing our panelists weave through their topics, to add questions in chat. We hope to bring some of those into Q&A and have a great discussion tonight. So with that, excited to jump into the panel portion and excited to introduce Karen forward. Also excited because she's my colleague as well. She's a managing director and a human potential executive in Accenture's strategy and consulting practice. And her focus is on advising leaders to address leadership culture and organizational challenges associated with achieving sustainability goals, how to transition to digital, and return to workplace in the current pandemic environment. Karen's going to talk a little bit about responsible leadership and sustainability. Over to you, Karen.
Wonderful. Thank you, Jimmy. And let me just pull up my screen here. And I'd appreciate it if someone can tell me if they can see my screen.
We can.
Okay, that's awesome. Wonderful. Well, thanks very much, Jimmy, and good evening, everyone. Really excited to be here today. Thank you very much for inviting me to present on a topic that I'm very passionate about. And as Jimmy said, I'm a leader within our human potential practice at Accenture, and I spend most of my time working with clients across industries to design talent strategy to help achieve business and organizational goals and where they're heading. And today I'm going to share a couple of perspectives really around leadership, one around as we kind of transition out of the pandemic, and then secondly, exploring a bit more broadly around some of the broader challenges that we're facing around sustainability. That you'll see this is also an additional thing that is coming on leadership agendas currently. So with that, you know, I don't need to tell you it's going to be a different world moving forward. I mean, it's very well documented that there's a lot of change that's happening, and it's really driven massive innovation effort, not only within healthcare, but across all sorts of organizations, governments, universities, and also individuals. And it's interesting that the pandemic's not just slowed innovation, but it's actually amplified it to what I'd say probably historic levels than we've seen before. And then when you think about healthcare organizations, you know, you look at how the sectors needed to innovate around life and death situations, right? And really calling for urgent action to happen as part of that. And what we've seen is that within healthcare is that people have been partnering with others in different ways than they've ever had to do before. And not only within the sector, when you think more broadly, there are new players that have been invited to kind of come in to help out as well. So if you take, for example, General Motors is a great example where they'd partnered with Ventec Life Systems to make thousands of ventilators. And that would have been unheard of before the pandemic. And then on top of that, a new era where people are really fundamentally reflecting on their relationship with work, very much thinking about it in a different way. And they're also turning to leaders in different ways to help them with their day-to-day and having new requests and asks that leaders have never had to see before. So what I would sum up is that, I truly believe this is an incredible time to be a leader. And I know lots of people are very tired and exhausted. It's been a challenging time for many leaders and many of you that will be on the call here today, but it is in fact a privilege. And when I kind of think of the degree of change that's happening at the moment, it's really to grasp that privilege because a lot of people are looking to all of us to help guide us through to the future. So over the next, 10 minutes or so, we're going to cover really three things. One is I'm going to talk a bit about people trends, and I'm going to explore more about some new impacts and pendulum swings, as we call it, that sit within that. And that's because we're seeing a lot of not only work being transformed, but the skills, the jobs are changing as part of all of this. So there's a lot going on. So I just want to try and sort of simplify a bit of that for everyone. Secondly, leadership, that shift now between not only just leading for value, but also values. And I know within healthcare, for example, a lot of it's been very value-led anyway, but we're really seeing a lot of that infuse across all industries currently and being very much that purpose-driven environment as part of it. And as we call it, is this emergence of responsible leadership, which I'll explore in a bit more detail. And then finally, a few takeaways, how can leaders adapt to this new world, and sort of leaving you with a couple of questions in that space. So, okay, let's start with some trends here. So, in a nutshell, people are pushing us to do much better, is the way I would summarize this. Organizations are needing not only to evolve how they deliver, not only to customers, patients, and their clients, but also evolving their workforce experiences in parallel with that. And it's the first time we've kind of almost seen that sort of customer patient experience match what's also needed for the employee experience as part of that. So it's the first time we've kind of seen that those two equate together. I want to kind of look at these trends. Group them into three areas. So we've got accelerated trends, new impacts, and pendulum swings. So when you think about accelerated impacts, I'll pick on one of these, the use of workforce data. We were using data before, but it's now completely grown over the last 2 years. So how many of you had to fill in, return to work surveys, for example, and really exploring everyone's feelings about being able to do that? That level of data never used to exist before, but now there are all these surveys and tools and assets that enable you to do that. And then the other thing is around the Great Resignation. So, this whole idea of talent mobility has accelerated dramatically. And I'll just, a bit of a fun fact is that, I don't know if any of you follow TikTok, but, one of the leading hashtags is quit my job. And I looked at that yesterday and there were 240 million views on that. So just to kind of show the energy that's sitting behind that with some data there. New impacts. So pandemic response has very much distinguished top tier brands. And I think this is a fascinating area. So not only within healthcare where you have been dealing and sort of tackling with patients kind of coming in and with everything to do with the pandemic, but also when you look at organizations like BMO is a really great example of where they made available their full training facilities for healthcare workers to be able to kind of rest, also be able to socially distance as part of that. So this is where you start seeing companies coming in and supporting in ways that they never used to before. But what's also interesting is that level of care that's been given to the community from those companies is now expected to be reflected internally as well now. So it's kind of been interesting to see that dynamic happening there. And then pendulum swings. So, lots of new technology being deployed very quickly. And you just need to look at contact tracing as a great example of that, but also collaboration technologies for, when you think about a remote workforce and being able to collaborate as part of that. And what some people don't realize is that this is having a really big impact on not only culture, which we've mentioned before, but also organization design and structure. So if you think of, and I like this term of extreme teaming has happened in a way that has not happened before. And that teaming has been outside of existing structures. So it's really creaking now around being able to adapt for that. And then on top of all of this, and it's also been in the news this week, you look at sustainability and our ESG targets and as a country, and you're starting to see the emergence of green skilling. And a good example would be that we've seen recently again in the news in the last kind of week or so is, this move to electric vehicles. And you may have heard this concept of a gigafactory, and we're having one outside or in Ontario anyway, where 4 billion's been invested in a gigafactory to be able to produce batteries to be able to support the growth of EV vehicles. So you imagine the skills even needed to do that are quite different than what has been before. So these are kind of really big pendulum swings that we're seeing in the talent space. Anyway, point being, talent is a priority. There is a lot going on. So what are the implications for talent strategies? So with demand for talent so high, there is a cost. And another interesting data point, and again, because it's public information, is if you take RBC, they'd reported that they'd increased its workforce by 2% last year, but the total HR costs actually rose by 8%. And this is the biggest percentage increase since 2013. I mean, that is significant impact from a financial perspective. Hiring talent is expensive. We know that the cost to hire talent externally can be up to 5 or 6 times more than being able to build the required skills from sort of within and internally within the organization. And then on the talent squeeze there, we're seeing an unprecedented attrition, but also retirements as well. And I know that is also we see it across industries, but we definitely see it also within nursing and with physicians as well. So organizations really having to think through their talent strategy. And I'm just going to focus on that top left box there, which is really doing a bit of a deeper dive into leadership. Okay, so right, enter responsible leadership. So let me tell you a bit more about what that's about. So when you think about what leaders are expected to do, and I sort of categorize it into 3 things. So one is around organizational performance. Now, whether that is within the healthcare sector or broader industries, it could be around whether it's achieving KPIs and targets. It could be around short-term earnings. There's a range of metrics that will kind of sit around organizational performance that typically get measured in the shorter term. And leaders are having to deal with that. Secondly, innovation. So when you think about, understanding technology and the investment in technology and being able to innovate, and that's over a slightly longer term in order to be able to do that to achieve goals. So that's more of a longer term kind of pressure that leaders are feeling. And then on top of all of that, and this is what's really new and I think is so accelerated, I've not seen it before, certainly in my time of in this space, is around sustainability and trust. And why that's really important is because leaders are having to deal with different groups of stakeholders than they ever used to before. And it's not just within their teams, it's not just within other groups within their organization, it's dealing with different kind of vendors, suppliers, providers as part of that. And they are demanding transparency about a lot of things, whether it's metrics, input. And this is just putting so much pressure on leaders than they ever had to do before. And the pandemic's completely kind of accelerated that. And I like to use this term of being this concept about sustainability and trust. It's how do leaders leave people net better off as part of that? And that's why we're seeing the emergence of responsible leadership. So if you think about, servant leadership has been a big part of the way that leaders are leading in many organizations. And just think of that now stretching to being adding this whole responsible leadership component to their roles. And as I like to summarize, is leading for value and values as part of that. So what are they having to do? So what is the work that's involved? Don't worry, I know it's a busy slide. I'm not going to go through all the words on this, but I'll just ground you in the framing of it because I think it is important. So when you look on the left-hand side, you'll see sort of the work areas, it's around the structure and the governance, it's around processes, it's around technology, that leaders are kind of having to lead through. And then they're going from a situation today to where they need to be to in the future. And when you kind of think of that time frame, I'll just give you an example of one from a ESG perspective and moving to EV vehicles as an example. We call it that decade to deliver. So think of it being that kind of 10-year kind of time frame where there's going to be some really big shifts in these areas. So I'll just pick a couple of examples to illustrate it. So if you take governance and structure, organizations currently have quite a narrow set of sustainability metrics that sit within that. And typically it's more philanthropic, if you think of it currently as it is today. Whereas moving forward, there's going to be a lot more rigor and governance and public reporting around those environment, social and governance kind of goals moving forward. So there's going to be that shift in that space. From a workforce perspective, if you think about it, roles, currently you have people that are doing specific kind of sustainability goals. The future will not necessarily be like that. It'll be expected to be part of everyone's role to a degree, but leaders also having a responsibility and accountability to drive that through their organization, but also it drives different teaming models to be able to do that. And then I guess a fun fact on the workforce side of it, and there's a really good study by RBC Economics where they explored, or that they estimated that there were 3 million jobs will be additional, or they will go through what we call like a green skills transformation moving forward. And on top of that, up to 400,000 jobs are going to be net new to be able to achieve these goals moving forward. So these are kind of big numbers. The other area too that I'll just mention is about technology and this whole move to sort of being more automation and robotic technology that's coming in, and that transition from people to that automation, but it also generating new skills to be able to do it. We call them missing middle skills that need to be developed in order to be able to manage that shift in technology. And you just take an example, I saw a good one the other day with the Mayo Clinic in Florida using autonomous vehicles to drive to transport medical supplies as part of it. So just so you know, even when you take autonomous vehicles like that, that is happening in the mining sector right now. They have autonomous vehicles out there on mine sites. So it's really interesting to see how this is really moving across industries. But leaders are having to tackle all of this. So when you start getting to looking at leadership competencies and capabilities, we've done a great piece of work with the World Economic Forum. Happy to share this separately after the session. Here is just a snapshot of it, where what we've discovered is that there are 5 elements that are key to sustainable organizations as what we call driver performance premium. And within these 5 elements, there are a certain set of capabilities that leaders can help kind of demonstrate to be able to drive what we call like a sustainability DNA within their organizations. So let me give you a couple of examples that sit behind this. So one is that, what you see here on the right, some of them may be new terms, some of them you may have already, but it's the combination of these very specifically together that do drive to purpose and sustainability DNA within an organization. So what we're seeing is that organizations are either, one, starting to build this into their leadership models. They're also building it into their leadership pipelines. And when you think of bringing up talent, how are you identifying that capability in those people? Secondly, a good example is equity, diversity, and inclusion. This is prevalent across all sectors that we're seeing at the moment. And the reason why this is important around sustainability is, one is it has board level attention. Broader stakeholders and analysts are expecting results on it. So it needs to be reported. There's a lot of transparency that's needed. And then when you look at that technology and innovation example further down, how technology helps that is, a great example would be with inclusion and diversity, is that the technology is now there to be able to assess policies and processes for language in those around bias within IND. So all of these things really closely interlinked together. And then the other example I would give is the World Economic Forum itself. Like, there is an expectation when it runs its key Davos event that you may have heard about, that it meets ISO standards, and every element of that event delivers on the sustainability goals that's been set globally. So it's kind of really interesting what they're doing in that space. So what I'll kind of leave you with is sort of three questions. So as I said, first of all, I really do believe that being a leader is a privilege in this world at the moment. There is no better time to be there leading your teams and, enjoying building your talent agendas. And then when you think of the pressures of coming out of the pandemic, but also then sustainability really hot on the heels of that, three questions. So, do you know who your stakeholders are? Do you really know them well? This is really important. It's so much more than your team now. It's very much around those broader who you interact with in society, your suppliers that you use, really have a very strong understanding of who they are, and also what the negative and positive consequences are of your organization's actions actually on those groups as well. Secondly, your leadership team, think about that 5 elements profile that I just ran through and sort of do self-assessment almost, just to kind of go, do we have the balance of this? Do we need to develop or grow in different areas in some of these skill sets? And then finally, what do you need to do to accelerate and scale this through your organization? And there's a couple of things you can do around that, which is one is around, well, understanding what you think the barriers actually are to doing that, but also if there are, think of it being, are there collaborations that you need to do to help push this through the organization? Training, for example, that we have. I mean, at Accenture, and Jimmy, you'll be familiar with this, is that, we even have now our sustainability quotient, as we call it, on training that as leaders we're expected to do, which never used to exist before. So I guess with that, I'll pause. I think I'm at time. So Jimmy, over to you. Do you want me to stop sharing my screen?
Yeah, that'd be great. And thanks for just a lot of enlightening perspectives. I think, Karen, this notion of responsible leadership and how folks are now adjusting in a post-COVID world. Everyone's had a different experience, especially a number of our frontline workers as well. And I love this concept of leading with value and values. One question for you. So you talked a little bit about kind of shifting mindsets in terms of employee expectations of employers too. And this concept or this framework of employers helping people be net better off. Would love just a couple of your thoughts on some of those dimensions that formulate net better off that employers today are exploring and investing in.
Mm-hmm. Great question. So so what we're seeing is it's kind of fun when you kind of think of the older world, when you think of well-being and being that sort of benefits kind of side of the business used to be part of like a total rewards part of HR, if you like, that they kind of manage that. Whereas what we're seeing now is it's much more of a holistic view of well-being and what that actually means. So it's spreading way beyond just more from a that sort of, I would say, that there's the kind of the emotional kind of side of it, but also the if you take the relational side of it, the physical side of it, also around the financial aspect of helping people actually be net better off as well, and having financial acumen as well as part of that. So we're just seeing it much broader around what does net better off actually mean for people. And we've actually got a piece of research as well that sits around that too, if anyone in the audience is kind of interested, that breaks down some of those components about what it means to be net better off.
Yeah, thanks very much, Karen. And you've made 2 offers to share research, and I think many folks in our audience will probably take you up on it. So thank you very much for your perspectives.
Thank you.
We're going to move to the next panelist. So very excited to introduce Sean Hinton, founder and CEO of Skyhive Technologies. Sean's a recognized thought leader, innovator in labor economics and future of work, having invented quantum labor analysis that marries economic theory with AI to produce the most advanced real-time knowledge graph of jobs, skills, training, and labor market intelligence in the world. Very excited that Sean's going to share some of his perspectives and a view into the future health workforce. Over to you, Sean.
Thanks, Jimmy, and good evening, everyone. Can everyone see my screen?
We can.
Excellent, thank you. So Skyhive is, we're a Vancouver-based company with offices in Palo Alto, New York, Dublin, as well as soon to be Tokyo. We were established in 2017 with a very non-ambitious goal, which is to reskill the planet and leave it a more capable place. We have, I like to say when I started Skyhive in 2016, the future of work was actually not a term that was well used. It's crazy to think about today that we see the future of work as so synonymous with what's going on in the world, but in 2016 this wasn't even a term. Going into COVID, obviously the future of work, and we can classify this. I sit on the OECD Future of Work Task Force, and often we think about automation and we think about digitization, but there are a whole lot more socioeconomic issues associated with the future of work, and that's obviously skills, women in STEM, pay equality around the world. We have now issues of a physical and remote workforce, etc. And so all of these issues cluster under what we know now as the future of work. So going into COVID, we would have seen a small drip. And obviously coming out of COVID, we now see a fire hose. And so some of the things that have changed in I think a post-COVID world are not necessarily reflective of COVID in and of itself, but reflective of where the world was going. It's just accelerated there more quickly. And we've heard some of that discussed already. And so one of the significant areas that I think is in the midst of a debate and not necessarily having that debate settled is this whole notion of a remote workforce. And there's a lot of discussion around the fact that we were able to prove with COVID that in a lot of occupations, we could move remote. But the conditions by which we proved it were a little bit skewed, and let me explain that. So going into COVID, obviously, we had all been, the majority of us, in environments where we were able to build social capital with our teams. And so we saw them every day, we knew who they were, in some cases we knew families, et cetera. So going into COVID and going into a remote environment, this made communication, teamwork, a little bit easier. However, a lot of growth has happened, a lot of change has happened in the last 2 years, and we are now faced with the reality that a lot of people are joining companies and joining teams where they've never actually met anyone face to face. The question becomes, in the absence of that pre-existing social capital, how successful is a model of remote work? And I'm not sure about all of you on this call, but I have a team of people, many of whom graduated university during COVID or just before COVID, and every single one of them wants to be back into the office in a hybrid environment. They do not want to be faced with a 40-year career where they're on Zoom calls, looking at small postage stamps. And so this is just a consideration around not leaning too hard into this notion of a remote workforce, because a lot of the data and discussions that we have with clients around the world suggests otherwise. Skyhive is a company that has set out to reskill the world and deploy what we call a skill passport to every single human being on the planet. We have revolutionized the methodology called quantum labor analysis, which is the application of artificial intelligence to analyze a workforce at its most granular level. So a workforce could be an individual, a set of individuals, a company, a community, or even a country. And when we set out to solve this problem, we didn't want to see sort of marginal change. We wanted to see exponential change. And so this idea of what I call a classical labor analysis, labor economy, where we're looking at job title level and credential level, is just simply not efficient. As we know, we can take any job title in the labor economy, project manager, that title's been the same for decades, but the actual requirements that go into doing the job are constantly changing. So quantum labor analysis is this massive engine that's collecting the world's labor market information, whether that's patent applications, annual reports, subject matter expertise, academic journals, job descriptions, and so on, and monitoring the labor economy in real time, but also harnessing machine learning to boil all of this down to the most granular quanta level of technical skills, soft skills, tools, technologies, methodologies, etc. It can be synonymous with a world of classical physics where we questioned quantum mechanics, saying, well, why would we want to look at the world at a subatomic level? But now we know so much more about who we are in the universe and science and technology as a result. We've simply applied this process with advanced technology to the world labor economy. And so SkyHive is able to answer 4 questions for large organizations, governments around the world faster than ever before. 1, what are the skills of my workforce today? What are the skills of the emerging labor economy that are impacting my industry, my competition, or that are going to impact my workforce over time? 3, what are the gaps that prevent us from moving in that future state? And 4, how do we mobilize our workforce at scale through training, upskilling, internal mobility opportunities to accelerate that progress to that future state at pace and at scale? We serve for our clients and for governments as a decoder ring to the future of work. And so we're able to monitor in real time what is happening in labor economies around the world, happening within 3 meters of a postal code. So we have 600,000 unique locations that we've mapped out across the world. We can tell what skills are in demand and supply on the east of the Nile and the west of the Nile, and so on across the world. And our technology is being used to rapidly reskill these companies and communities around the world. And I'll provide a few use cases in a moment. So I was asked to prepare just some insights on the healthcare labor market in a post-COVID world. And so I'm just going to provide a very few snapshots and data points that are providing us some indicators. Obviously, there's a multitude of information that we can be presenting, but I'll keep my comments brief. Oh, excuse me. So the emerging roles and top and functional skills, here's what we see as the top 3 healthcare occupations. So obviously, physicians and surgeons, clinical laboratory technologists and technicians, and technology in and of itself. And as was already stated earlier, technology is becoming integral to leadership in every sector, including in the healthcare sector. And we're monitoring the changes that are happening in terms of the importance of these skills within roles. And so we can see even down to a skill level, is that skill rising in terms of importance in a role, or is it fading away, or are a set of skills becoming new roles as things emerge where we begin to define what you would know as future jobs? In terms of talent density by country, what we're looking at here is where is the biggest gap in supply and demand? In other words, where are the misalignments in the labor market that are going to cause systemic issues that are going to take several years to solve? And so obviously we can see that there is a relatively sufficient workforce across a number of locations around the world where tweaks to skill proximity and focus on identifying internal mobility efforts will be sufficient in terms of figuring out labor market challenges. And then there's countries that are in significant scarcity. And so it's interesting to look across the world and to be able to look at best practices that are existing in countries where that labor market misalignment is either nil or close to nil, and to determine how they're targeting these occupations with respect to talent acquisition, the upskilling, reskilling of employees, and creating an overall attractive workforce to bring folks from other occupations into the workforce. In terms of a couple of the use cases that I've mentioned previously, so at the beginning of COVID, the federal government of Canada asked us to support them with applying quantum labor analysis to the Canadian labor market, really in three key areas. The first area was to identify close proximity pools of labor market participants that could easily be reskilled into roles that could serve any potential overflow that would have been needed in terms of support. And so as an example to this, we ran an analysis across the entire labor economy of Canada and broke everything down to a quantum level. And occupation number 4 on that list was housekeeping. And at first we thought it was a false positive. But when we went to dig into the data, we realized that a large portion of that workforce were actually medical professionals from other parts of the world who had come to Canada as newcomers. And so nurses, radiologists, medical technicians, et cetera, and that they could be rapidly reskilled and certified to play frontline roles in response. The second use case it was sort of phase 2, which was the identification of manufacturing facilities around Canada that could have been rapidly mobilized to convert into respiratory equipment and PPV manufacturing. And so we were able to look at companies that weren't necessarily in that space, but had a high concentration of experienced workforce participants that could have facilitated that shift to the manufacturing environment. And so that was phase 2. In phase 3, we began to look at vaccines. And so both from the R&D side of the labor market all the way through to commercialization and deployment. And so this was work that was only accomplished in real time with quantum labor analysis as an example. The future of home healthcare, we were asked to support with identifying a large talent shortage. And so starting to look out into other occupations across the labor market to identify individuals very similar to that housekeeping example that could be converted through reskilling into health, home care aides and home health aides. And so we saw a big shift during COVID of a lot of folks moving from retail and consumer as well as hospitality, because obviously those two areas were impacted by large furloughing of employees in the early stages of the pandemic into home health care aide roles. And this was mainly across North America. And so this serves as one of the themes to what I would want you to take home with you tonight, which is skill proximity is going to be of utmost importance to ensuring that we're able to continue to adequately grow the healthcare system and respond to the demands that are on it right now. Skill proximity suggests that when your labor market pool is empty, that you need to go fishing in other labor market in other pools. And in order for you to go into other pools, you need to understand the pools to be fishing in to do that most expediently, and as well as having formal upskilling and reskilling programs in place. So when we begin to see the supply and demand trends we could see over time, this was going into COVID, and then this was coming out of COVID. And so we've just analyzed this, in this case, just one role, and we've done an analysis of the labor market supply and demand characteristics. So we can see that supply is dwindling in terms of home healthcare aides, and demand is also in some respects decreasing. So we're seeing that there is a normalizing effect that's coming in the labor market. So that should give us, at least as it pertains to this occupation, a little bit of breath of sigh of relief that, okay, this is starting to normalize and we're starting to see this come back to whatever we want to call a new normal sort of standard. But this is the type of analysis that we apply across all roles within the labor economy. So in terms of skill level comparisons, we do segment by various geographies. And so we can see urban, rural, and suburban, where we can do analyses on the most in-demand skills, also the most supplied skills that are occurring within particular geographic areas. What becomes very important here is when you're competing for talent, you're going to want to understand how those skills pertain to compensation levels, because we can geolocate and map talent and the type of compensation structures that are required in order to attract that talent. In terms of career pathway comparisons, so when we then begin to zero in on the proximity occupations or the proximity skill sets, we then bring in the salary and compensation details. We already have the supply and demand details. This now begins to paint the picture as to the gap, and this is where you see the percent match, the gap that is in between that occupation and what we're looking for to come into healthcare. And with that gap comes the identification of training opportunities. So how do we begin to develop structured curricula that's going to be able to respond to upskilling large components of the workforce into these new roles? So in conclusion, we're seeing in many areas of healthcare, and especially home healthcare, we're seeing the steady states of demand, but we're also seeing a supply that's catching up to that. We're understanding that there are geographic differences. We're also understanding that from a proximity perspective, we can see occupations that we wouldn't necessarily have considered to be relevant to this particular occupation. We can see proximity being very, very tight, very, very close, and a clear pathway to reskilling. And there are skills within these occupations that are very constrained. So this is another element to be paying attention to. It's not just the job title that we're looking at when we're examining the labor market. There are very niche specific skills that are coming into the labor market that are in drastic shortage, although it may not be reflected yet in the job title. And so this is the importance of understanding these roles at a quantum level. And then obviously, as I've stressed already, the importance of skill proximity. So if there's one other thing that I could sort of leave in terms of leadership in a post-COVID reality, it's ensuring that you're paying attention to the data and the capability. As it was said previously, technological innovation that was taking years prior to COVID is now taking weeks, months. And so we're able to bring data to a discussion that otherwise wouldn't have been available. And this data is going to derive the difference between a competitive organization and an uncompetitive organization moving forward. At SkyHive, for example, we're a B corporation, we're a for-profit social impact organization, and we believe very strongly that reskilling for the future of work is only going to be achieved through a combination of art and science. And so you can bring the best technology in the world to the table, but if you don't enable the artists, the practitioners, the human resource professionals, the teachers, the trainers, the mentors, the coaches, with the new methodologies to help support holding someone's hand through that last mile of reskilling, then the best data in the world is not going to be effective. And so happy to have those conversations offline if there's more you'd like to learn.
Yeah, thanks very much, Sean. Very enlightening, and it makes the mind go in different places. Really, lots of incredible data points and examples. And where you ended there, I think just on occupations that are seen as atypical. I wanted to maybe look at the healthcare system macro from a financial sustainability lens. So we know that healthcare spend is always on the rise. Percentage of GDP is at 10%, and 40% of Canadian spend in totality is on healthcare and increasing. So knowing all these shifting labor dynamics, different occupations that are atypical but could serve well, what advice would you provide health system planners who have this responsibility, I think, to to design and fund services that are delivered and by whom?
So especially in areas, and we see this a lot as we're talking about the Great Resignation, there are significant talent shortages in some area, and there are no shortages in other areas. And so we have this situation where the amount of jobs that are available, vacancies that are open, and the amount of people looking for work is almost exactly the same. The trouble is right now is matching those two things. So to come back to your question, the first reaction when faced with a talent shortage is to raise salaries. We heard that earlier, where spend is 8% when the workforce growth was 2%. This is not going to help the systemic issue that you've just alluded to. And the reality is that solving this problem is not going to be through rising compensation levels. Solving this problem is going to be about burrowing in and understanding the inefficiencies within the system and ensuring that all systems and practices can be modified to the new normal. And that goes to the piece on art and science. It is not going to be the same system that it was before. And if people or companies or communities try to keep it that way, they're going to be uncompetitive. So instead of going outwards with a bigger checkbook, I would look inwards with a tighter belt, tightening of the belt.
Thanks, Sean, and thank you for your perspectives. We're going to shift over to Dr. Sriharan. Abby is an internationally recognized award-winning health systems innovation scholar. She's the director of Leadership Wellness Lab and a senior Krembil fellow at the Krembil Center for Health Management and Leadership. And her current research focuses on compassion-based leadership, on work culture, workforce performance, and systems innovation. So we're really happy to hear her perspective. She's going to share with us the health workforce shifting from reaction to proaction. Over to you, Abby.
Thanks, Jimmy. Okay, let me go. Okay, good evening, everyone. And I'm just going to talk to you a little bit about some of the work that we are doing at Krembil, looking at the current health workforce crisis and taking a lens through what can systems and leaders do to address these emerging crises. Like Jimmy mentioned, I'm a senior Krembil fellow at the Krembil Center for Health Management and Leadership. So this is an exciting time at Krembil because this is a much needed area of research, and our research is funded through grants from CIHR, SHIRK, and Associated Medical Services. So I want to give an acknowledgement to our funders. Just to give you a little bit of context to health sector and what's happening right now, post-COVID era, like Jimmy talked about in the introductions, we are seeing backlogs from surgical to diagnostic backlogs. Some of the studies that's coming out right now that shows just with the 2020 backlogs around cancer screening, we are going to see additional 20,000 deaths in the next 10 years because of the delays in diagnostics, delays in treatments. In the fourth quarter of 2021, there was 70% increase in labor market vacancies in healthcare because we couldn't fill our nursing and other allied health things. This is not only a Canadian problem, it's a global problem, right? In the US, they are calling it the Great Resignation era. Like we are seeing physicians and nurses leaving workforce in huge numbers. It's the same issue in NHS in UK. It's the same issue here in Canada, Australia. In 2021, October, the fall of 2021, all the major medical professional societies came together and said, we need to address the health workforce crisis. If not, the system will crumble. We can't sustain our service delivery needs. Just to give you a little bit of context about what this healthcare crisis problem is, this is a study done by my colleagues at Sunnybrook Hospital who looked at oncology workforce. So this is your cancer physicians, surgeons, oncologists, medical oncologists, and radiation oncologists pre-pandemic. This is the pre-pandemic data. And 71% of the Ontario oncologists are dissatisfied with their work. Over 70% have indicated they are feeling burnt out in the workforce, and partly because of some of the control systems that we have within the system, right? So it's their ability to work, the poor control over workload, feeling pressured by external systems to work outside of the regular hours, lack of leadership support is huge. So the burnout and the healthcare workforce crisis is not a new thing during COVID. It actually happened before COVID, but COVID actually has given us an opportunity to shed light into this problem. Recently, last month, American College of Healthcare Executives did a CEO survey of all the hospitals in the US. First time in 20 years, workforce shortage has come as #1 concern. Registered nurses, primary care physicians, specialists, all the fields, right? So we are seeing a huge workforce crisis needs. If you have looked at the recent, the last week's healthcare reform that came out of Quebec, workforce crisis. We need more workforce, and one of the strategy is let's recruit from other countries. Ontario recently introduced a new policy. Again, it talks about international recruitment, making it easier for internationally trained health workers to integrate into the healthcare system. But what's happening is this is happening globally, right? So we are recruiting internationally, US is recruiting internationally, Australia is doing this, France is doing it, and everywhere else there's a demand for health workforce. So what's the right solution to address this problem? The other thing that happened in Ontario is we have like 2 new medical schools, increases in medical school capacities that were announced recently. Those are all great things. But for those physicians to get trained and to come into workforce, it's going to take about 7 to 10 years, minimum 7 years for a family physician. We are looking at 10 to 15 years for a specialist to come. So what's going to happen to our healthcare needs in that period? And then some of the data that's coming around workforce burnout issues, billions of dollars are being spent on burnout and absenteeism and anything related to stress and disengagement. A recent study from US showed health physician turnover and reduced clinical hours is costing about $4.6 billion to the healthcare industry in the US. A similar study from Canada showed $213 million. So think about the cost of these unaddressed problems around burnout. And if we continue to kind of keep this in the same old system, it's not going to improve how things are working. So what we do at the Krembil Leadership Lab is we are looking at what's happening in the healthcare workforce. Why is this burnout happening? How can we address this? So one area that we are interested in is looking at the female health workforce. Again, 80% of health workforce is female globally. In Canada, about 45% of our physicians are female, or self-identify as women, and then about 90% of our nurses and about 99% of long-term care workers self-identify as women. Huge sector, but our solutions are not addressed towards workforce and the gender. Right? So we start looking at what are some of the reasons, why are we having these issues? What can we do to address these things? The health workforce burnout and the crisis is a complexity challenge. It's not a simple solution to say, let's give employee assistance program. And Karen talked about that. The human resource approach to providing wellness programs is no longer working. We need an integrated, holistic approach because the burnout happens related to job factors. It happens because of management factors. It happens due to value factors when there's misalignment with your own values and work values, compassion fatigues, fairness concerns. And there's also cultural factors, right? So work environment and safety cultures and all of those things. So one size fits all, one approach is not going to work in terms of addressing this workforce crisis. And then if you look at the business model of how healthcare is organized, even though healthcare is delivered through hospitals and community centers, there's silos. There's hospitals who gets funding through the ministries. There's physicians who are independent practitioners who are governed by their own professional regulatory agencies. And then there are nurses who are also governed by their own professional regulatory agencies. And there's that complexity of these professional regulatory environments, the systems, the hospital management, and trying to align all those things is not an easy task. So another thing that we are kind of looking at right now is how do we kind of address some of the hierarchies within the healthcare environment? How do we kind of create team-based care, improve workforce burnout and moral distress? I mean, we have seen increases in moral distress among nurses as well. We know from organizational behavioral studies, a lot of my Schulich colleagues know the work that you guys do, workplace culture has influence in employee performance. And happiness, we know the positive correlations between workplace happiness and performance. We know about how employees are satisfied and employee productivity goes up when the work culture is positive and thriving. We know the connection between employee satisfaction and staff turnover. But in the health environment, this is really complex, right? Because like I talked about, the business model is very different. Even though physicians work in the hospitals, they're not an employee of the hospitals. Even though the nurses might be working in the hospitals, they may not be the employees of the hospital because they might be a contract nurses. So there's all sorts of complexities that add to this work culture. And so the solutions are not, again, simple one-size-fits-all solutions. So what do we need to address these problems? And one of the things that's emerging is we need high-performance leaders, and their leadership behaviors will influence well how the workforce is going to function in the work environment. So a recent study that we have done, looking at mostly around the COVID pandemic, is like what type of leadership is required to address some of these crises. And what's emerging is, we have task leadership, people leadership, but what's really needed is this adaptive competencies. And Joe talked about that in his opening remark. It's about the leader's ability to think through a systems lens, the leader's ability to make decisions based on emerging dynamic evidence and the changes, and be able to kind of take into account the structural variations, the cultural variations, and the political climate variations. So it's not just simple as let's get things done or let's provide the employee benefit programs. It's about kind of trying to function in between those two environments. And some of the emerging competencies that's coming from our work is we need leaders who are trained with the innovation mindset, right? So why do we need innovation mindset? Like Sean talked about, there's a lot of technology and innovations that's happening out there. The data science and AI and machine learning has the power to address some of the problems that we are facing in healthcare, but we have not utilized it. So how do we train our healthcare leaders to be able to understand the power of these technologies and to be able to rethink, reimagine how healthcare is delivered? So that's one option. The other competency that's emerging from our work is around systems mastery. So healthcare is no longer a siloed thing that happens in the hospitals, right? So how do we integrate care between home and systems and social care and the hospitals? How do we provide aging at home options? Who do we need to bring in as partners? It's not just hospitals. So the new innovations, the new transformations happening in Ontario with Ontario Health Team is a great opportunity for us to think about the systems perspectives. So this is again a new key emerging competency for healthcare leadership. A good example is our EMR systems in Ontario. So any of you have experienced doctor's visits recently or in the last year or so, you would go to your doctor and they will say, oh, I don't have access to your record. You may have to go and pull this record from this place. And you have to then go and get that report from the hospital to your family doctor, and the family doctor to the next family doctor. We have a multi-system structure here, right? Because there's no single EMR system. This is the list of all the EMR offerings that Ontario has. So depending on which family doctor or which hospital you go to, they will be working on these different systems. There's lack of integration. And what happens with this lack of integration is we have lots of data, but they don't really talk to each other, right? And this is where medical errors happens. This is where increased cost happen. And then we look at some countries like Australia and Singapore, where I know Alberta, they have in Alberta, we have a provincial EMR system. Australia, the whole country has one EMR system, right? And Singapore is moving towards that. And what will happen is, regardless of where you are, what you're doing, your information is portable. And whichever doctor you're going to see, they'll have access to your complete medical record. And think about the power of that. So again, that systems thinking is needed in terms of fixing some of the problems that we have. And the final competency that we need to think about, and Karen talked about this too, is the human factor mastery. It's about emotions. It's about understanding what's going on. Again, the changing landscape of healthcare workforce, and we are seeing mostly female, it's a female profession, right? In Ontario, like Canada, like I said, 95% of our nurses are women, 42% of our physicians are women, and yet there's a 11 to 28% gender pay gap. Our policies and procedures, like the guidelines, don't align with what women in health workforce require. Because most of our structures are done based on 1960s of workforce. And we are in 2021 or 2022 right now. So we need policy innovations. We need systems that thinks about human factors. And if you kind of go into long-term care, most of our long-term care workers are women as well. So the UK, for example, NHS is starting to rethink their workforce policies. It's about how do we work flexibly. Like, unfortunately, as healthcare workforce, you may not be able to do everything from home. The work-life balance, that concept of working from home may not work because you need to be in person. You need to provide care in the front lines. But there are other things that you could do from an organizational perspective to provide flexible work environments, providing that opportunities for work-life balance for women in healthcare so they don't leave workforce. Right now, what's happening is PSWs, once they get into the job market, they only stay in the job market for minimum 3 to 4 years. We know nurses stay in the frontline clinical care minimum of 5 years, right? And female medical graduates often take on part-time medical roles because of caregiving responsibilities and things. So even though we are spending a lot of money in training and recruiting and training the workforce, the work environment is not supportive to keep them engaged full-time in the workforce. So how do we rethink about the workforce and the workforce policies so we could get maximum benefit from them as well as they get maximum benefit from the system? So we recently just got a recent grant from CIHR to kind of look at retention of women in healthcare labor market. So this is a brand new study that Krembil will be involved with Ontario Hospital Association, CKITS, Ottawa Health Research, UHN, and CAMET. So I'm looking forward to sharing this work next year with you all. We'll have more data by next summer. Thank you for the opportunity, and I look forward to have dialogue with you. That's my email addresses, and you could also find me on Twitter at Sriharan Abi, or you could see us at Krembil Center.
That's fantastic, Abby. And look, we're offering research, reports, articles, sharing our email addresses. Fantastic panel. Abby, thank you for sharing this incredible research that you're a part of, and for digging into helping us understand more about workplace culture. The thing that came to mind when you were sharing some of your research and some of those headlines around I guess the future DNA genetics traits of leaders being adaptive systems thinkers, is that everyone in the sector is exhausted and tired and overwhelmed. And I wanted to get your view based on your research and your experience in the sector. Like, how can healthcare leaders evolve as leaders using some of the characteristics and research that you've been looking at when they're at their boiling point today?
Yeah, no, thanks, Jimmy, for that. The thing is, healthcare is a team sport, right? So by default, in healthcare, leaders have to work together, and they work together. But one of the recent research that we have completed, and we are writing on that results, we studied leaders during the early days of pandemic, healthcare leaders in the early days of pandemic. And the crisis actually brought people together because we are all in this together, and we need to kind of bring the collective strength to be able to address this unknown emerging threat. So that's one of the things that happens with the healthcare environment. But what came out of that work too is recommendations that we need to rethink how we train healthcare leaders. And it's not just one-time training, it's about lifelong trainings. And the training opportunities also brings that interdisciplinary collaboration opportunities. Joe and I have been talking about how Krembil could actually play a role in this space to bring in that interdisciplinary leadership training for healthcare leaders so we could kind of sustain this. So yes, we will be kind of thinking about a lot of applied training in the future.
Yeah, so providing training and greater supports in a time when folks at large are struggling. They put in a lot of energy and passion over the last 2 years. Thanks, Abby, for your perspectives this evening.
Okay.
So with that, we're going to open it up to a little bit of Q&A and some questions, and I'd encourage each of our panelists to jump in and share some of their perspectives. We talked a lot actually about competencies, and we know that the last 2 years have altered or affected maybe what the profile of quote unquote effective leaders look like today. I wanted to get your perspectives based on your areas of expertise as to what you think some of those priority competencies should be for our leaders as they try to emerge post-COVID and be successful.
Do you want me to kick off, Jimmy?
Sure, thanks, Karen.
Yeah, so I think, I know I talked a bit about 5 kind of key kind of competency kind of key capability areas that we see as it relates to coming out of the pandemic and into this sort of looking at sustainability. I think there are intertwined with all of those, there are kind of, well, I'm going to pick up on 3 things that I see. One is this whole uber teaming that has never existed before on the basis that it is. Like the way teams have had to work is like nothing we've ever seen before in breadth of their teams. So that's one thing I think is a key capability, is being really comfortable in extreme teaming as part of that. And then the other 2 elements that sort of intertwine those 5 points that I mentioned, and it gets a little bit to where like Sean and Abby are going about the data, right? So there's something about having human connection is getting to a new level that sits within those areas. And then the other is, as we call it, that kind of, how do you get that collective intelligence and the data that feeds all of those different areas to really drive planning, which, I mean, Sean, I was, looking at your data there. I mean, it's just extraordinary, like the kind of insight that we're starting to get now than we ever used to before. So that's my perspective.
Thanks, Karen. Abby, over to you.
Yeah, one of the things that's emerging, Jimmy, is oftentimes we kind of say them and us, in a sense, leaders and us, kind of that separation. Changing that viewpoint, because as part of one of our work, we talked to leaders, healthcare leaders, and the burnout factors. And they said, we are also in this together. We are also feeling that burnout. And when we are feeling burnout, we don't have the bandwidth to even think about what our team needs. So this is about, like, it's almost like thinking about your self-wellness as a leader. And when you demonstrate that behavior, your team is also going to focus on that. And when everyone feels that you are in a thriving environment and feeling that resonance within yourself, that's when creativity happens. That's when innovation happens. That's when collaboration happens, right? When you don't feel that resonance and you are in this dissonance in an environment, there's going to be toxic work culture and burnout, and then it's a vicious cycle. So it's about leaders kind of role modeling the wellness culture is key to be able to get that holistic wellness approach that Karen talked about earlier.
Yeah, thanks, Abby. Sean, any thoughts on this one?
Yeah, so we obviously see a lot of organizations moving to what's called an impact skill profile. And so employers are beginning to look at core skills that everybody has in the organization in terms of measuring success. And the top 3 that we see today with leaders, one is digital dexterity, 2 is empathy, and 3 is there's kind of I would put it into green skills, really understanding, I think DEI, digital dexterity and green. These are becoming the core skills across any occupation. in varying degrees.
Yeah. Yeah. Thank you all for sharing. We could start a podcast just on that question, I think, alone. So thank you for that. Shifting gears a little bit. I mean, in our mission of the Krembil Institute, I wanted, we're undergoing massive change. We've all realized as a sector, as people, that one can predict very little. So if you think about the pandemic, you think about technology, you think about really rapid digital transformation. Would love to get your advice to students and future leaders on how they can start to think about and advance their competencies so that they can more confidently confront these changes ahead of them. Maybe I'll start with you, Abby.
Yeah, one of the things that I talk about for healthcare leaders, you need to be anthropologist, right? You need to have that ethnographic mindset to say, I want to sit back and observe what's going on around me, or in my work environment, my patient flows, my staffing. And that's when you would be able to see what are some of the innovation opportunities. Because oftentimes we are in that constant changing environment and we focus on the task. But if you sit back and be an anthropologist at some times, you could see the opportunity. So I would recommend all the graduates being trained in these areas to master the skill of sitting back, observing. That participant observation is a key skill set leaders can bring into this table.
Thanks, Abby.
Maybe I'll just chime in a little bit on there too. Because I think it's not just students. I mean, it's kind of everybody that's going through a bit of a transformation. I mean, Sean, you were talking there about digital dexterity. I mean, I'm going to put my hand up here to say, was my career all geared towards AI? No, it wasn't. I'm having to go through back to basics training on what AI is, what cloud means, just some real basics, data, like understanding data and the breadth of data. So there's just, like, I would just say, my advice would be to students is not to be afraid to be really curious about some of these areas, and access to finding access to different kind of training capabilities is a lot easier than it used to be kind of in this space. I mean, you just need to look at like LinkedIn Learning. There's all these different kind of options, the way people can go at some of that, and lots of different providers that can support that too. But I think it's interesting, like as a student, it's not to think you're that much different actually from some of people that are already in the workforce that are having to adapt to the changes that are happening too. Yeah.
Yeah.
I would just like to add, if anyone thinks that this generation of learning is going to be consistent with anything from the past, they're completely mistaken. So there's this thing we have in technology called Moore's Law, which is effectively the speed at something compressing every 18 months, drastically and exponentially compressing. We have to remember that it was literally just less than 15 years ago that we saw iPhones. And since then, the connectivity of the world has exponentially grown. Today, though, only 57% of people in the world are connected to the internet or even have basic access to the internet. Only 57%. Now, for the first time in the world's history, over the next 3-5 years, everyone will have access to the internet. Not necessarily the ability to access the internet, that's a different question, but probably within 10 years, most people on planet Earth will be accessing the internet. So we're talking about the addition of 4 billion people to the digital economy. And what impact is that going to have in a period of rapid exponential change in the way people are working and the way people are learning? There is no textbook for this. There is no history for this. And so it's the spirit of curiosity and understanding that the shelf life for the careers that we have, the skills that we're acquiring, is going to be significantly different than any time in the past.
Yeah, thanks for closing on that question, Sean. I mean, you all kind of raised that the world is going to look different. It's accelerated. Your point, Sean, around the infrastructure will look different and is looking different as well. and that's going to create new economies, new skill economies as well. A last question for this group. So, COVID, the pandemic has created this intense period of reflection for all of us on a number of topics. And healthcare has been hard hit. Would love a reflection from each of you on what each of you is hopeful for as healthcare gets its footing coming out of the pandemic. Maybe Sean, I'll put you on the spot and you can start first.
Yeah, so I think my view, and it, it's my thesis, so can be argued one way or the other, but my thesis is that in 120 years of recording labor economics and management science, the pandemic has marked an exclamation point to the inversion of the labor economy. And what I mean by that is what we've considered to be demand on the employer side and supply on the candidate worker side is flipping. So we need to start to get our mind around, as employers and leaders, we will be applying to candidates, not the other way around. And what I'm hopeful for in healthcare is that view becomes sort of part of the narrative and urgency applied to that we as employers are applying to the workforce, not the other way around.
Thanks, Sean. Maybe Abby, to you next, and Karen, last word.
Yeah, no, I think the pandemic allowed us to look at some of the wastage in healthcare as well, create some opportunities for innovation, right? So overnight, we went into virtual care processes, which took us like 10 years to kind of think about what do we need to do, how do we need to keep the systems alive. So that crisis opened up that. We also saw, because of the pandemic procedures, the hospitals had efficient appointment times. So patients goes in, they get their appointment, they walk out. So that wait times, the increasing wait times, overcrowding of wait rooms, all of those things were eliminated during the COVID pandemic. So there's many innovations that happened during pandemic that we can actually think about taking those opportunities and say, how do we sustain those innovations, as opposed to saying, let's go back to what we were before the pandemic, right? So how do we build on these strengths that we have found during pandemic and move forward, as opposed to going back and say, everything is back to 2019, let's go from 2019 onwards.
Thanks for that, Abby. Karen, last word from you.
Yeah, it's a great question. Gosh, I was just trying to racking my brain a bit about it. And I come back to this, I guess, the decade to deliver, that this kind of concept just as a thing, and just thinking that sort of 10-year kind of journey. And I think a couple of things kind of come to mind is one is we are not seeing the level of sort of technology meets human ingenuity come together in the same way. I am so excited about what the possibilities kind of are in this space. And I think the challenge with that, and this is what I'm hopeful for, is that we really do embrace the change. Like this is something that's happening like way faster than before. And I think it's that, as leaders, it's being prepared to be very open to this. And when you look at change over the eras, if you like, that have happened before, it's nothing like it is now. And, it's just not been left behind.
Thanks, Karen. Yeah, I think we have no choice but to adapt, move at speed, and the factors around everyone are different. So with that, I wanted to say thank you to each of the panelists as we close off this part of the Q&A. Weighed in, very excited about all of the topics, and covered a lot of ground, and we're all very privileged to get to hear some deeper perspectives from each of you as well. And thank you to our audience for bringing some questions forward. So hopefully we got a few of those out there for you. I'm going to pass it to Joe to close us off. So thank you to everybody. Joe, you might be on mute.
Talk about digital dexterity, Sean. In my professorial hat, I would say this was an A+, really. Intellect, and one KPI is, are we smarter than we were about 2 hours ago? I know I am, so thank you very, very much. Our second Leadership Summit comes to a close. And on behalf of the Krembil Center for Health Management and Leadership, I want to thank Jimmy Yang, who, by the way, I forgot to mention, is a Schulich grad, MBA 2007. We're so proud of you, Jimmy. Karen Forward, Sean Hinton, and Dr. Abhi Sriharan, together with all of our participating attendees for making it so insightful. Please note that we'll be posting a video of our proceedings shortly. You can access the recording at schulich.yorku.ca/Krembil Center. Once again, we hope that this evening's proceedings provided you with food for thought that will help you lead the way post-COVID. The pandemic has reset major workforce trends, as you heard this evening. The imperative for leaders has been suggested throughout our summit, is to adapt adroitly to move their organizations forward smartly and successfully. They obviously have to rethink workforce and employee planning. In particular, I strongly suggest experience strategies, or what is more appropriately referred to as the humanization of our workplace or a belonging environment. A key takeaway, among others, we heard this evening. We also hope that our students have been inspired by our speakers and are energized with the opportunities ahead of them. I want to conclude the summit by thanking the people who helped to put it together. A superb team at Schulich, including Don Wotiki and his marketing team, Anna Lee in particular, Alomo Gravel, Alumni Relations, and Anuruddha Namjoshi, MBA student specializing in health and industry management. And a very special gratitude, of course, to Nudi Sejwal, Program Manager for the Krembil Center, who organized our summit so professionally and so enthusiastically. And finally, we want to thank each of you in the audience. The mission of the Krembil Center for Health Management and Leadership is to advance high-performance management and leadership. Our journey continues, and we are delighted that you are on board with us. As I said in my opening remarks, industry outreach is one of our key pillars. We'll keep you informed of our plans, and we are already planning our fall summit. Thank you again, and good evening.